The Ministry of Health says healthcare providers will be among the first in Grenada to be vaccinated against COVID-19. Acting Chief Medical Officer Dr. Sean Charles says once a decision is made on the type of vaccine Grenada will acquire through collaboration with the Pan American Health Organization and the World Health Organization, frontline workers will be given priority. Grenada has already signed on to the COVAX facility with PAHO and the WHO. Dr. Charles said the expansion of the priority group will depend on the quantity of vaccine the country can obtain.
Our plan addresses which of these vaccines that we have the capacity to deploy right now, and I can tell you at present we do not have the capacity to neither store or deploy the ultra cold chain, the vaccines that require ultra cold chain. That's those that require minus 80 degrees or so. In terms of the priority for vaccination, I believe I touched on that at a previous press conference, where because of our small health workforce, we need to protect them and to ensure that they are up and functioning and keep the system running. So our frontline workers, in particular our healthcare providers, will be our priority group for vaccination. Now, of course, there are persons who have underlying conditions. They are also high up in the priority for vaccination.
Health Minister Honorable Nicholas Steele says Grenada's focus will be on accelerating the process for acquiring the vaccine. He is confident that with the guidance of the WHO, Grenada can bypass all the logistical and health challenges and find the right vaccine.
One of those vaccines has already been certified by WHO. That one, which is the Pfizer-BioNTech, has challenges logistically, not just for us, but for even the very same first world nations that are implementing it. You will see in today's headlines that there are questions in terms of the rate of implementation. It is because it needs what is referred to as extreme cold chain. It has to be kept at minus 72 degrees throughout its process, getting it here as well as storing it here before distribution. So it poses challenges. We haven't ruled that out. We have addressed and looked at what we would need to do to deal with the Pfizer-BioNTech if that is the one that we end up going with. There are other vaccines like the AstraZeneca that do not require that level of cold chain, that level of minus 72, that have a level of storage and temperature-wise that we are accustomed dealing with, that we deal with right now with other vaccines and medications.
Minister Steele emphasized that all travelers arriving in Grenada, whether they were vaccinated overseas, are expected to quarantine at an approved facility on island.